On Wednesday, February 14th, officials from the Ministry of Health hosted a stakeholder consultation to release the findings of their 2019-2020 Pan American Health Organization PAHO, World Health Organization WHO, STEPwise Approach to Non-Communicable Disease Risk Factors Surveillance Survey, also known as STEPS. In her presentation, Non-Communicable Diseases Senior Medical Officer within the Ministry of Education, Dr. Shannon Sear-Philbert, addressed the various risk factor behavioral trends and metabolic trends which continue significantly to contracting non-communicable diseases.
There are major risk factors for non-communicable diseases. Generally, World Health Organization states 5 main or major risk factors for non-communicable diseases. Within the survey, there's one of them we would not have asked about per se, which would have been our air pollution, quote unquote. But within the survey, we would have asked quite a bit about particular habits which affect the likelihood of getting a non-communicable diseases like cancer, diabetes, cardiovascular disease, chronic lung disease, to name the main ones.
She further stated,
we would have preferred 60% of our population to have 0 risk factors. You agree? Unfortunately, that's not where it was. We had the 0 risk factors barely noticeable, right? Because they're just so low, you know. When you look for the red, which corresponds to both sexes, it was 3.9% of that nice big population, yeah? And remember that they're a representative sample, so you can actually extrapolate the information to cover what you expect to see in the solution population, right? And 1 or 2 risk factors, so any one of the 5 to your extreme right, I believe. Oh, yeah. Any one of the 5, we had 60%, almost 61% of our population having 1 or 2 of those.
The ministry's consultant statistician, the former Director of Statistics Department, Edwin St. Catherine, outlined the research methods used to carry out the STEPS survey, its implementation, and lastly, the findings.
So by using these standardized questionnaires and protocols, all countries can collect data on the same health risk factors, which can then be used to inform public health action and policy making. STEPS provides an entry point for low and middle income countries to get started on non-communicable disease surveillance and is the basis for the global NCD monitoring framework.
Following the stakeholders meeting, the NCD committee within the Ministry of Health unveiled their plans for targeting NCDs and risk factors in 2024. The STEPS survey is a straightforward standard procedure for the purpose of gathering, analyzing, and disseminating information about chronic diseases and the risk factors that accompanies them, such as alcohol and tobacco use, physical inactivity, poor diet, obesity, and high blood pressure. For Choice News Now, I am Chelsea Austinay.